Hi, Oluchi here. Let's talk needles today. During my practice in Nigeria, I did not come across this. This is a blunt tip needle. It's a blunt tip needle. You only use this needle to withdraw medications. Just to withdraw medications. It's not your regular sharp needle that you use to give IM injections. You only use it for this. This right here is sterile water. You only use it for this, just to withdraw. If you need to mix the medication or whatever, all the mixing and withdrawing, you can do it with this, but don't poke a patient with this, because it will be very traumatizing, because it's blunt tip, it is not sharp. So this one right here is 18 gauge. That's talking about the diameter of the needle. It's 18 gauge and 1 inch. 1 inch is talking about the length of the needle. This one right here is also 18 gauge, but the length of the needle is 1.5. Though IM injections are not so they are not as popular as they are back home. As in, it's less frequently given here, but it will be easy for a nurse who has not had experience with this, to poke a patient with this. So this is just to bring this to your attention, not to poke a patient with this, but just use it to withdraw. Then just a quick tip on giving IM injections. You should choose your needle based on the patient. If the patient is on the big side, it means that the muscles will be farther away from the skin. So you use a longer needle. You use a longer needle based on the size of your patient. If the patient is maybe a child or an adult that is thin, you use a shorter needle, because you can easily get to the muscle with a shorter needle. Unlike a bigger patient, who, if you use a short needle, you may end up giving subcute, not intramuscular. So that's why it's very important for you to take note of that. There is varying types of needles here. There are so many of them. This one is an example. You see this one is different, it's sharp. So this one can be used for IM. This thing right here is just for safety. When you finish, you just cover it like this so it doesn't poke. You discard it. So there's a lot of technology around needles. There are some needles for withdrawing, which you will find has filter. The filter may be attached to the hub around here. So that's mostly for when you want to withdraw medication from an ampoule. An ampoule, you break it. So it may have pieces of glass inside. So when you use that filter needle to withdraw it, the filter will catch all those pieces of glass, so you don't have to send it into the patient. So be mindful whenever you're giving any kind of injection. Be mindful of the equipment you use, the kind of needle you use, the kind of syringe you use. Be mindful of that. It's not like back home where everything is just black and white. You only find one kind of syringe. You only find one kind of needle. So, but here there's a lot of technology. There's varying type of needles, varying type of syringes. So you have to make sure that you review what is frequently used in your unit and use the right thing for the right patient. Thanks for listening. See you in the next video. Make sure to share, like, subscribe, and follow for more. Thanks for listening.